We all know I've been navigating this health journey of chronic illness and all the things, but what you didn't necessarily know is that one of my dogs has also been navigating a difficult health journey with me. This is Peach, my baby girl. She's so pretty. As you can tell, she's not feeling very well. You see, Peach is part German Shepherd, and she's one of those dogs that she generally does a pretty good job of hiding when she feels not so great. She went on fluoxetine, Prozac, a couple years ago because, the German Shepherd, but also she's part pit bull, and she's just very reactive, has some anxiety, so we decided to get some medication to help her with that, and it helped her tremendously with her anxiety, but unfortunately it also relaxed a lot of her muscles that caused her to have very severe acid reflux. She's also prone to allergies because of all the breeds that she is, seasonal allergies, so she's on medication for that. And during the summertime, it's really difficult for her. We have to manage her with lots of medicated baths, medicated wipes, because she's prone to hot spots and all of that. We had managed her acid reflux pretty well with omeprazole for a few months. About 9 months ago, she had x-rays done because she had a vomiting episode where they looked at her esophagus to check if it was abnormal, like potentially megaesophagus, and it looked normal. And then a couple months ago, she ate some chicken bones out of the trash, so we took her to the vet immediately, and they did an x-ray and were able to get her to throw up the bones, and she was generally okay. But about a week ago, she had a coughing, regurgitation, vomiting spell where she threw up about 23 times in the span of 3 to 4 hours. So I took her to the urgent care because our vet didn't have any space available, and they listened to her lungs. They said they sounded fine. They agreed with me that it was an acid reflux flare-up. I brought up the possibility of aspiration pneumonia, which is when a dog inhales what they are throwing up and it gets in their lungs and it causes pneumonia and an infection. But the vet at the time listened to her lungs, said they sounded clear, but if she had any symptoms of it, to bring her back. She was on this medication called sucralfate, which we've done before, which you grind it up into a paste, add water, and syringe it down their throat, and it helps coat their throat and their stomach. And that really improved her symptoms because her esophagus was so irritated from all of the vomiting. Oh, and here she's having another coughing fit. It's okay, baby. They also gave her a Cerenia injection, which is for nausea, to get her to stop throwing up. When she came home, she wasn't throwing up anymore. She was immediately interested in food. She was generally okay. And they gave us some other medication that helps with nausea, but we didn't have to use it at all during the week because she wasn't nauseous. And then yesterday, literally an exact week from when this has previously happened, she had another episode where she ended up puking a total of 45 times. And it was for a 2-hour span. I was following her around the house, cleaning it up, just trying to comfort her as this was happening, on the phone with my vet, trying to see if they could get her in. They couldn't get her in. And they scheduled me for an appointment tomorrow morning, but I just had, my gut was she's not okay. She was panting, she was having labored breathing, she was trembling excessively, and I was feeling her face. It felt very, very hot. So I ended up taking her to urgent care. They took her temperature, she had fever, and they ended up deciding to do x-rays. Her stomach looked totally clear, so then they did chest x-rays, and they found bronchitis, which is likely due to recurring issues with aspiration pneumonia that just had gone uncaught, unmitigated. She likely had it, and we just didn't realize that she was coughing because a lot of her cough would happen when she would jump down off the couch to go bark at something, and she would spit up while it was happening. So we thought it was GERD. We thought it was the acid reflux. We didn't realize that it was her coughing, and her coughing so hard that then she started to spit up. And also in her x-rays, it showed the possibility of her having a expanded esophagus. We're not sure if that's what's happening, but it's a possibility. So she was very, very sick. They also did a Cerenia injection. We brought her home last night. She didn't want any food, didn't want to take any pills, wasn't interested in anything, was coughing constantly. The coughing wouldn't stop even after the Cerenia. So to give her medication for that, which is a steroid and an antibiotic similar to when humans have pneumonia, we had to grind them up with water and syringe them into her mouth, poor thing, because she would not take it with food. Didn't want to eat anything. She got a little bit better overnight, but she still is very lethargic. She's not really herself. She's drinking water, fortunately. And she'll get up, if someone comes in the house, or if I get up to do stuff, and she's kind of interested by it, but for the most part, she's laying here. She's pretty lethargic. She's finally been able to fall asleep because she's not coughing so much, but it's all been very stressful. And I did get her to finally eat a little bit of food, spoon-fed her literally about an hour ago with some wet food that I got for her. And so I'm hoping I can continue to feed her more, but we may go back to urgent care if she continues to not feel so good, if anything worsens, if she continues to cough. So this is your sign to also just like trust your intuition when it comes to your pets. Like, you know your pets better than anybody. And unfortunately, like, vets are very expensive. Obviously, like, I know that people don't always have like the financial stability to be able to take them. And for that, like, we've been using Care Credit for a lot of this because I don't just have a bunch of money sitting around either. But Care Credit, at least like with small enough charges, you have 6 months to pay it off before there's any interest. So I like having it because I know that I can take her and at least know that I will be able to pay with something, even if I can't pay in the moment, because my pets are my kids, you know, and I won't let anything happen to them. This is also a PSA that pneumonia is something that has a really good prognosis if it's caught early, but if it's caught later, the prognosis of them improving is significantly less, and people often don't know what to look out for. So things to look out for with pneumonia is lethargy, labored breathing, breathing, coughing that sounds wet. Also, if they're hacking a lot, hacking and then spitting up, that's regurgitation, not vomiting, and that's a sign of, you know, things going on with their lungs. Another is fever. If you can get like an anal thermometer for a baby, and that's how you take a dog's temperature. A healthy dog's temperature is 102.5, 103.5, 103 is considered elevated, but 104 is like officially a fever. So if they're at 104, which is what she was at yesterday, that's a sign they're not doing so good. They need to go to the ER. Also checking their gums. Their gums should be pink to red. If they are purple, blue, white, and they have labored breathing, they're lethargic, they don't want to get up, they're not responding to their name, those are all signs you need to take them to urgent care immediately.